So when we're looking at outcomes from any one center, there are a few benchmarks that may help you in terms of your decision of who to seek care from. One of them is how many embryos are being transferred in any one IVF cycle, fresh or frozen embryos, frankly. And centers that do a high proportion of single embryo transfers have pretty good confidence in their embryos that it's going to work. And I think overall the trend has been more towards single embryo transfer, again for healthy mothers and healthy babies, and to avoid preterm deliveries. And in Michigan Reproductive Medicine Laboratory and in our practice, over 50% of our patients have a single embryo transfer electively. And I would say a good benchmark among clinics would be if at least 30% are doing that. So we have good confidence in the outcomes for our patients, and our outcomes based on one embryo back is really the benchmark that should be used to compare clinics. A second area is also in the area of donor egg, because if you have optimal eggs, outcomes should be good. And that can control a little bit as long as donor selection is good. That can control for some of the variabilities in women's ages of what clinic is taking care of what type of patients by age. Egg donors uniformly are usually in the range of age 21 to 30. So what is it like when you have 21 to 30-year-old eggs in women that don't have infertility? That may be another benchmark for a clinic. Now, the CDC only began collecting information on frozen donor egg in 2015. So this is very recent. We've been doing this since 2010. So a lot of our outcome, 99% of our patients are doing frozen donor egg, so they weren't even prepared for us to share that information with them until recently. And since the CDC is always at least 2 years in the rears in reporting, you're not going to see that data out for a while in any sense of volume from clinic to clinic. So if our center has 2 cycles of donor egg, well, the other 70 cycles aren't being reported because there was no avenue in which to report that information. And what we see overall with our donor egg bank IVF outcomes is around a 60% pregnancy rate. And the vast majority are single embryo transfers. And that's a solid benchmark for the quality of our laboratory, the quality of our management to our patients and care, and it's world-class level outcomes.